Hi, this is Dr. Vinitha Puli, Clinical Director, Obstetrics and Gynecology at KIMS Cuddles, Kondapur. Today, we are going to discuss about a polycystic ovary. Very many people will be bothered by a polycystic ovary. Lots of questions will be asked. What is it? Do I have it? Will I have problems getting pregnancy? Will I have problems in future? So let us see each one in detail. When we scan someone and if we notice in the ovaries, there are small water bubble like things arranged around the ovary, inside, obviously inside the ovary, but around the middle of the ovary. We describe them as polycystic ovary. There are tiny cyst-like structures. They are not big ovarian cyst. So a lot of women will get confused whether I have ovarian cyst. Having ovarian cyst is different to having polycystic ovary. These are very tiny water bubbles, whereas ovarian cyst is one big cyst in the ovary. So if you see that, what impact does it have? What problems can you have? It depends on your age and what problems you might present with. Not all people with polycystic ovary will have the same problem. Some will have irregular bleeding, irregular periods, straight from the time when you start having periods. Some will have regular periods for a few years and then develop irregular periods. Some will have lot of problem putting on weight and they will not be able to lose weight so easily. Some women will experience extra hair on lips, chin, chest and tummy that can be very disturbing. And some women will have problems with fertility. When they want to get a pregnancy, they will be unable to have a pregnancy. So, the women who have polycystic ovaries, we usually advise them that later, after a year of maybe 40 years, there is a possibility of you having increased chance of developing diabetes or increased chance of having high blood pressure later in your life. So for that reason, we also recommend everyone to have annual checks to make sure that you are not developing diabetes or high blood pressure. And in younger ages, if you have problem with irregular periods, what do we do? So our problem is irregular periods. We have to think of few things. What is the reason for irregular periods? Is it only polycystic ovary or is it something else? Sometimes there could be associated problems, so we always check in blood to make sure there is no other problems and no other hormone disturbances like thyroid and diabetes. If you do, then we will treat that first and also treat polycystic ovaries and thereby regularizing the cycles. Sometimes you require regularizing the periods by help of pills. So it's constant 21-day pill pack that we give that will improve the hormone profile, at the same time regularize the cycles. So when you do have episodes of few months of regularizing pills and few months, you can stop and see whether you get regular periods following the pills. If you still have irregular periods coming back, you can restart. So stopping and starting, you can do few months on and few months off. But what can you do in that few months when you are off the pill if you still need regular periods? When you are on the pill doesn't mean that now the pill is taking care of everything. We also need to do few more things like lifestyle changes. Lifestyle changes means having a balanced diet, means not having too much junk, fizzy drinks, too much of oil and lots of carbohydrate. This is not healthy. Lots of fruits and vegetables to be included in the diet. The more fruit and vegetable that you include, more healthier your diet becomes. Less of carbohydrate, less of fat, more protein and lots of exercise. That is what is required for healthy lifestyle. When you follow this healthy lifestyle, the need for you to be on regular medicines to have regular cycles will be reduced. So naturally there will be a hormone balance and naturally you will have regular periods. So the first and foremost thing for us to do is to have this lifestyle changes, and that should continue throughout life for us. So it is not like, okay, 3 months I do exercise, I get 2-3 regular periods, will stop everything altogether. No, it needs to keep going and throughout life, and thereby you can prevent long-term or future problems or postpone them for quite many years. In case if we have no problems with irregular periods, we are having regular periods, but our problem is unwanted hair, then what should we do? Same thing again, lifestyle changes will improve hormone balance, but at the same time you can also contact dermatologist if there is no hormone imbalance for the treatment options that you can have for unwanted hair. So we should not despair that you have unwanted hair. There are lots of long-term options that are available to get rid of this unwanted hair. What if there is fertility problems? Fertility problems can be a huge concern, and we see many women these days with problems of fertility, especially when you have polycystic ovaries. What should we do? So when you are trying for fertility, you have regular or irregular periods, you might have to undergo few tests including hormone test, scan, and your husband or partner should have a semen analysis test. When all other tests are fine and your problem is only ovulation because of polycystic ovary, you will be required to take some medicines, and we follow with scans. We call it as follicular study to see whether the effect of medicine will bring on ovulation, that is egg formation, development and release. If that's happening fine, then you have good chance of having a baby. If that is not happening or quite resistant to the medicines, or there is no effect of whatever medicines that we use, even injections, then there might be a suggestion from the doctor that you might require a laparoscopy. What do we do at laparoscopy? A laparoscopy is putting a small camera like a keyhole and having a look inside the tummy. We see the ovaries and we do drilling of this ovaries, which are small polycystic in appearance. By doing the drill, there will be an improvement of hormone balance, and you are more likely to respond to medications following the procedure. It is not a definitive procedure that once you get this done, your polycystic ovaries are eradicated for life. That polycystic ovaries are for our life, and we can only reduce the problem it is going to create for us. So all our attempts of lifestyle measures should continue despite having laparoscopy. So I'm sure we have now worked through our ways for problems with PCO, including menstrual problems, unwanted hair problems, or lots of weight gain or fertility concerns. Now, keeping on doing the lifestyle measures will postpone your chances of having high blood pressure or diabetes later on in life also. Sometimes, to improve your chance of not having diabetes, you might be required to use a tablet called metformin, which improves the hormone balance and also reduces weight. So later, after 40, don't forget to get your annual checkups done to rule out diabetes and high blood pressure. So to have a reasonable, good, happy life with polycystic ovary, we need to concentrate on our healthy lifestyle. Thank you.